Hola, hola. It's your host, Dr. Janice Castro, licensed psychologist. Just as a reminder, this podcast and this episode is not a replacement for therapy, but I do appreciate y'all listening. And I encourage you to subscribe and leave a review in case you haven't already. Today, we're going to talk about ADHD and hormones and how they interact, because there are some weeks when hormones impact your brain and you do not feel so great. And other weeks where you're like, I'm good, I'm fine. Quick fact. ADHD in childhood, the diagnosis is 3 times higher in males than it is in females. So you'll see that in childhood, usually it is boys who end up getting the diagnosis, and then girls end up getting a late diagnosis, because all of a sudden in adulthood, the number of people who get diagnosed with ADHD between males and females, guess what? It shrinks. It goes from a 3-to-1 ratio to 1.5 to 1. So hormones do play a big role in that. I'm going to break it down so you can understand what's happening inside your brain during the month. There's going to be 3 players. We got 3 players to keep in mind. We got the dopamine. Dopamine is what people with ADHD struggle with, is not having enough of it. When you do have enough dopamine in your brain, it helps you stay focused and motivated. The next player, number 2, estrogen. Estrogen is a hormone that boosts your dopamine. So when estrogen is going high, guess what? Your dopamine is going high too. And then number 3 is progesterone. This is what slows everything down, making ADHD symptoms worse. I said there was 3 main players, but I'm going to bring up a 4th one. Surprise, we got testosterone. That also plays a role. It can increase your impulsivity, and it can make some weeks even more challenging. So when we think about the hormonal menstrual cycle, there's 4 weeks to keep in mind. We got 2 phases. We've got the follicular phase and the luteal phase. Follicular phase is those first 2 weeks. What do I mean by the first 2 weeks? Week 1 is when your menstruation begins. This is when you start your period. Your estrogen is low. What happens when the estrogen is low? Your dopamine goes low. So what happens in your body and your mind and your emotions? You got low energy, you got brain fog, you can't concentrate, you got low motivation, you feel tired, you don't want to talk to people, you feel less social. What's a tip during this week that you are in the start of your menstruation? Rest. Don't push yourself too hard. Can you take a PTO? Can you take a vacation day? Can you take a sick day? Can you ask for help, even though these are things that you typically don't do? Light exercise. Don't push yourself too much physically. Maybe this is an opportunity for you to journal, because it allows you to be more self-reflective, since you're not really wanting to socialize. This is a time where you might think that you're being lazy, but you're just tired, and that's okay. Then, as the days go by, week 2, you are hitting maybe day 7 to 13. You're towards the end of your period. Guess what? That estrogen is going up. And if estrogen is rising, your brain gets that boost. You start to focus better. Your memory is improving. You feel more patient. You are socializing more. You want to be around people. I do want to acknowledge, remember that 4th player that I said, oh, there's a surprise player, testosterone. So testosterone is actually also rising during this 2nd week. What happens when your testosterone rises? I did mention it increases impulsivity. So if you have ADHD, specifically if you have ADHD, the hyperactive impulsive presentation, be mindful. Because if you have higher impulsivity, then you might notice that you're starting to get into that shopping impulsivity. You might struggle with, if you struggle with substance use like alcohol or drugs, you might start to feel impulsive and just want to do those drugs or alcohol. So the best tip I can give is just being mindful of when you notice the impulsivity is creeping in. Plan how you're going to do your tasks, your days, so that you don't let that shopping, that substance use creep up in moments where you're just bored. And then also set some goals and try to enjoy that boost as much as you can. Now, week 3, this is the luteal phase. Because remember, I said week 1 and week 2 is follicular phase. And then week 3 and 4, that's the luteal phase. Week 3 is usually around day 14. Ovulation is happening and the dip happens. What I mean by the dip is premenstrual cycle symptoms, PMS. And for some folks with ADHD, you may be prone to premenstrual dysphoric disorder. So what happens during week 3? Your estrogen is peaking, and then all of a sudden it drops real quick. And you start to have mood swings. You start to feel this brain fog, irritability. Your progesterone is also rising. Remember, progesterone is what slows everything down and makes your ADHD symptoms worse. So you may notice that you feel more sensitive. Your brain maybe just feels slower. You're not as sharp. And so the best tip I would give is be kind to yourself, practice the self-compassion, plan for rest days, and avoid overbooking yourself. Now, week number 4, this is the storm before the calm. And I call it the storm because, y'all, those last couple of days right before your menstruation cycle starts is hard sometimes. I think about it as like a hibernation mode. This is when your estrogen takes another dip down. And remember, that impacts the dopamine. So you may notice yourself maybe more sensitive to rejection or criticism. You might start to take things very personal. Maybe you're feeling more anxious than usual. Or if you struggle with major depressive disorder, you may notice that you're starting to feel maybe some symptoms of depression, especially if you do have premenstrual dysphoric disorder and your focus is going down. So the best tip I can give is stick to simple routines. Try to do less and trying some grounding exercise, and maybe avoid making big decisions during that time because you know that you're feeling extra sensitive. So a lot of women get misdiagnosed with anxiety, depression, bipolar disorder, borderline disorder when they are signs of ADHD. But because these 4 weeks that we just talked about, there's so many hormones that are going up and down depending what week you're in and which presentation of ADHD you have, it can make it really hard for doctors to know what to diagnose you with. And sometimes you have multiple diagnoses. That happens too. So you're not alone with that. I do want to say that it is important to consult with your psychologist, your therapist, or whatever medical provider you want to be able to get further information on diagnoses, because it can be really hard to know. A statistic that blew my mind, y'all, was that girls with ADHD, so, females in childhood, they are 6 times more likely to experience teen pregnancy. Why is that? Because of the impulsivity and the difficulties with thinking about consequences, long-term planning. So this is an example as to why untreated ADHD can really have an impact on a person's life. This was based on a study out in Sweden, and it was published back in 2019, so a few years ago. So I do want to just bring that up because we want to make sure that we understand how important it is to be mindful of getting the support that you need. And if you ever feel like a doctor dismisses your struggles, get another one because you are not alone. There are good doctors and bad doctors. There are burned out doctors and good doctors. And so they're going to sometimes overlook things. And I just want to encourage you to keep advocating for yourself. So to wrap it up, y'all, ADHD isn't just about focus. It is definitely deeply connected to hormones. And understand that by learning more about your cycle and what your symptoms look like, because I gave a very brief overview of those 4 weeks, and not every person's body is the same. So that's just a very generalized understanding of cycles. And I want you to be able to understand your cycles so you can help yourself work with your brain instead of against it. It's not a one size fits all. Everybody's experience with ADHD is also different, right? Different presentations, different symptoms, because you got also different things going on in your life. And this is an opportunity to raise awareness about ADHD and how it can look different for women and the challenges that come with it. And also, I want to acknowledge that we want to challenge the stereotypes. That it's not that you're just too sensitive or you're too much. Your body is going through something that is out of your control. It's okay to not be okay and to ask for help. And we want to be able to listen and practice empathy and also remember the strengths because it's not all bad. If you found this helpful, please share it with somebody and let them know what resonated with you. That's it for today, folks. Thank you for tuning in and be kind to your brain.